Okay. My name is Molly McDonald, and this is my case study 3, carbidopa and Parkinson disease treatment. So, a quick overview. Carbidopa is a medical drug that is administered alongside the drug levodopa to treat diseases like Parkinson's disease, which is also referred to as PD, and similar symptoms. Carbidopa is a D-carboxylase inhibitor, with the ability to prevent levodopa from being broken down before being able to reach the brain. With this mechanism occurring, lower doses of levodopa are able to be given to treat such, which aids the patient with less nausea and vomiting, which are both side effects of levodopa. Levodopa is a precursor in dopamine that can cross the blood-brain barrier, which then increases the dopamine production to help manage PD symptoms. Carbidopa is added alongside levodopa to help lower the peripheral conversion of L-dopa to dopamine, which then reduces gastrointestinal side effects and increases levodopa bioavailability in the central nervous system. So, an overview of Parkinson's disease. PD is a disease that is aggressive and very progressive that results in a brain disorder that leads to the difficulty of movement and/or mental health or health issues. This is due to decreasing the amount of dopamine secreting neurons of the substantia nigra, which then leads to the following symptoms, which include motor symptoms, including bradykinesia, cogwheel rigidity, resting tremors, shuffling gait, postural instability. And to the right, you can just see a quick little symptoms more pointed out where this occurs on each of the bodies. This is very targeted at movement symptoms. It causes muscle strain, and overall less mobility. So the carbidopa mechanism of action, according to source 2, the mechanism of action for carbidopa is binding to PLP, which then inhibits the AADC, which is a PLP-dependent enzyme. Next, AACD acts to metabolize 5-HTP to serotonin and L-dopa to dopamine, which allows the CNS, central nervous system, to take up levodopa where the carbidopa cannot cross the blood-brain barrier. This overall is the only enzymatic activity that can occur, and it has to be peripheral. Gastrointestinal absorption can be increased through the decrease of peripheral conversion of levodopa to dopamine, which ultimately allows less dopamine in the GI tract and a decrease of possible levodopa side effects. As mentioned previously, this includes nausea. So the carbidopa structure and X-ray crystallography. So X-ray crystallography is a tool for analyzing and obtaining a 3D molecular structure through the crystallization of a purified sample at a high concentration, where the crystals are used to expose an X-ray beam that gives different diffraction patterns to be processed and then yield information about the symmetry and the size of the unit being studied. The atomic detail and minimized amount of restrictions makes it ideal for in-depth visualization of molecular structures, in this case, focusing on carbidopa. They use a program to analyze the results of the X-ray crystallography, which is Chimera. Chimera is a program that enhances the visualization of 3D electron and microscopic data to be shown alongside X-ray density maps, electrostatic potential, and other data. These maps are incredibly flexible and can be edited and modified as necessary. But overall, Chimera is used to show the binded structure of cardopa. And to the right, I included the structure of cardopa and levodopa. So in conclusion, Parkinson's disease treatment would not be nearly effective if not for carbidopa and levodopa. So through the carbidopa inhibiting the DDC, it allows more levodopa to reach the brain to therefore be converted into dopamine, which overall controls the symptoms more efficiently. This improves motor control and allows an overall lesser amount of levodopa to be administered, which further controls the side effects. This is overall a very important medication in the treatment of Parkinson's disease and can even aid other similar symptoms, and these include symptoms as swelling of the brain, nervous system injuries caused through carbon monoxide poisoning or manganese poisoning, similar symptoms of PD like tremors, muscle stiffness, mobility issues, and other things that are caused by a lack of dopamine within the brain. And here are my citations. Thank you so much for watching.